Okay, so for my podcast reflection, I chose a patient who has been suffering with migraines. My preceptor told me that while I was on spring break, she would come in a lot before track practice just with really bad migraines, and she couldn't really control them and didn't think that she'd be able to do the complete running practice. So my preceptor just had her bike and kind of take it easy so it wouldn't make her migraine symptoms worse. And so after looking at the podcast website, I found the Headache Relief and Prevention podcast, which I think would be very beneficial for this patient. This could be used before practice, so she could come into the athletic training room, and if that day she did have a headache, we could use this to give to her before that she could relax and just try and reduce those symptoms a little bit more than what she already has been during the day. And then that can be the determining factor of if her symptoms got better or about the same, or if they even got worse, then we would decide what to do with her for practice that day. So that's how this could be used for her when she has a headache. It also could be used there's a headache prevention aspect to this podcast. So like I said before, she can come into the athletic training room after school, but before practice. Even if she doesn't have a headache, she can still go through the headache prevention script, just so she can be relaxed again for practice to make sure that if she even did have the slightest headache, that these would help prevent it from becoming like a big migraine, and just keeping her relaxed and ready for practice, and just knowing that overall she can complete the practice without having those symptoms increase or get worse. When and how would we know to use this podcast? So kind of like I said before, we can have her come in to the athletic training room before practice. We can have her do this every day. Even if she's not having a headache, we can use the prevention one. If she is having a headache, we can use the one that you give to patients when they do have a headache. So just knowing that we can use this on the front end and the back end before she gets the headache, and if she is suffering from the headache and migraine. And how do we measure its effectiveness? I would say that if for a few weeks we give her this podcast when she does have a headache, if we give her the podcast before practice and after listening to the podcast her symptoms are less or her headache goes away completely, I would consider this pretty effective. So we could use the GROC scale, a global rating of change scale, to see what her score is before listening to the podcast if she has a headache, and what her score would be after listening to the podcast to see if her symptoms got worse or better, or how she's feeling based on that. And we could also just use the numeric pain scale, so if she's a 9 or 10 before listening to the script when she does have a migraine, and then afterwards she's only a 3 or a 4, I would say that's pretty effective in reducing her symptoms and her pain. But if it's been a couple weeks and it's not really helping with their symptoms at all, it's not reducing her pain, or she's not feeling any relief or change after doing the podcast, and her headaches are just staying the same, then I say that it's time to look for a new option for her and trying to get her a different podcast or something different that can try and help with those symptoms. So just making sure that we're not just using this as the final answer, making sure that it is effective and that it is benefiting the patient the most.